Today we're interviewing Bishop Sheldon Mwesigwa. He's the bishop of the Ankole Diocese of the Church of Uganda and is also the chancellor of Bishop Stewart University in Mbarara. We're grateful for the opportunity to speak with you today, Bishop. Thank you for taking the time.
Thank you, Doug. It is a pleasure to be interviewed by you. Good.
We've known each other for a good number of years, and I've known your spirit and your heart for the people in Uganda and appreciate your leadership. We learned recently that the House of Bishops selected you to actually be on point to go and find out information about the COVID vaccine. Tell us a little bit about why the House of Bishops wanted you to do that, and what did you learn from that? What were some of the big things that came from that experience?
Thank you, Doug. I think what exactly happened is that we have some link with Bristol Diocese. How is it the situation of COVID-19? And then we told them that now we are in the phase whereby they are saying we need to use vaccines, but very many people are hesitant. And I told them that I was one of them who was very hesitant. But I told them that I was concerned that I had my mother who is 90 years old and asked, could she be able to take the vaccine at 90? And in that discussion, Chris Dobson, who is the global officer, ecumenical officer for Bristol, said, oh, by the way, we in our congregation, we have a Christian scientist who works at Oxford University. Jenna, she was willing, and she answered almost all the questions that I had. And from then on, I caught the fire.
Oh, wow.
Vaccination. And I got my mother vaccinated. I also got vaccinated. I mobilized around especially the aged 70 years, 80, 90, and we have a good number Christians who have been loving their God, living godly lives, careful about their health. I was so worried that they could be decimated by this new virus. And so as I speak, I thank God that this was done. And as I speak, I really thank God because in my diocese, we lost one elderly priest before we had gotten even the vaccinations. But after that, we have had 3 priests who had COVID, but they have recovered. And almost all my priests now are vaccinated. And we really thank God. So we see that really the assurance we got. Later, we even had the House of Bishops to engage with the 2 of the team who were involved in vaccine development, Dr. Marion Watson from Oxford University and Dr. Mustafa Bitai, a Gambian. You know, one of the questions was, maybe there's any secret agenda to decimate Africans. And here was on the team, an African Gambian. So, and many other questions. So we really thank God. We've come to believe that it works. We've encouraged people to have the vaccines, and we believe they make a difference.
What do you think is driving that fear? When you say people are concerned that the vaccine could decimate Africa, people aren't saying the COVID will decimate Africa. They're saying the vaccine could decimate Africa. So what's behind that, do you think?
I think mainly the social media is what rules the world now. There is a lot of negative information on social media in the direction of saying vaccines are dangerous. But of course, the justification some of them do have is that over time in history, there have been some examples of medicine being used maybe to cause some havoc. True, science sometimes has been used for wrong reasons, but we need to appreciate that science, for the most part, is the reason why many of our people are living.
Have you had any kind of pushback against your thinking or your leadership, or anybody saying we don't want to hear the church speak to this? Or is the church actually able to help change people's hearts and minds at this time?
In Uganda, we are very lucky. Actually, the medical superintendent for Mbarara Regional Referral Hospital was appreciating me and saying, thank you. Bishop, for speaking out. You've helped us.
Mm.
That's why we've been able to do a lot of vaccinations in our region. Ankole region is one of those which is doing well, because as a religious leader, I've spoken out, and a few others. Some of the religious leaders are also not talking. They know best why they are not talking, but I'm someone who is always guided by the word of God, because we are on the watchtower, because the word of God, I think is it in Ezekiel, which says we are a watchman.
Mm.
If blood of the people spills and you have not warned them, the blood of those people will be on your hands. But if these people, you talk to them and they don't heed to the warning, then you have no case. So for me, I take that seriously. As a leader, I have a level that I've gone to, even of education, even of exposure, even my faith as a leader, where I feel I have an obligation to guide my Christian. So I thank God that the medical world has appreciated. Actually, the problem is from the Christians themselves. Some Christians, especially in Kampala, there are some pastors, there are some priests who are also discouraging people from taking vaccines. They are talking of 666, the mark of the beast, and all kind of queer things. But sadly, actually, a good number are also, we are getting cases of some dying. And I think that way probably some will wake up and realize. So the greatest negativity is coming from some Christians, not from medical people, not from politicians, but some Christians. And even these Christians, I want to believe actually they are getting the messages from even, Lord forbid, probably even as far as the US, because the Christians in the US are very negative to some of them, I must say, the conservative, they are very negative. And to vaccines, which I read, and many of them relate. So I want to imagine this is where the problem actually might be coming from, more than any other place. But as on my part, we are the Archbishop himself was vaccinated publicly, actually Church of Uganda. It is us who have come out. Other churches also, you don't see them easily coming out to be in the open, really. But as of now, where we are, there is hunger for the vaccines in Uganda, very big hunger. People have come to appreciate them, actually, I must say.
Thank you very much, Bishop. I really appreciate you taking some time to meet with us today.
Welcome.